Hello everyone. So today I'm going to talk about anorexia nervosa, which is a very important topic in the psychiatry portion. So anorexia nervosa is basically an eating disorder where the patient presents with weight loss. Okay, but these patients, the anorexia nervosa patients, they don't really have an insight into their condition. Okay, their condition is characterized by strict avoidance of food, so they have characteristic rituals for food, and they mostly avoid high calorie food, and they have some extreme form of weight loss, but they still consider themselves fit. Okay, so they are not ready to admit that they have lost a lot of weight. And what are the other things that characterize anorexia nervosa is these patients have specific role models for weight. Okay, so maybe some models or any specific weight target. Okay, and these patients, they also do constant mirror checking to check that if they have gained any weight. All right, so these patients don't really have an insight, so they are either brought by their parents or they are brought by their partners. Okay, but they don't really come by themselves on their own seeking help. Okay, so let's see how we are going to take the history here, what to do in examination, and how to provide management to these patients. So, as this patient presented with weight loss, we need to take the history in that direction. So, in the P1, we'll ask about how much weight have you lost and over what time, okay? And is it intentional? All right, is it intentional? And if yes, then we will ask why have you decided to lose weight? Okay, so the kind of their motivation behind losing weight. And do you have any target weight, any specific weight target, any specific role model in terms of weight? And do you keep checking yourself in the mirror? So these are all questions that kind of give you an idea to quantify the weight loss, and what are their intentions, and some questions to points toward the direction of anorexia nervosa to confirm the diagnosis. Then we have another thing which is called as SCOFF questionnaire, and SCOFF questionnaire for eating disorders, that is anorexia nervosa and bulimia nervosa. It is similar to the KHDWD mnemonic for alcohol dependence and drug dependence. Okay, so it is kind of a quick questionnaire, and if the answer to any of the five question, any two of the five question is yes, then it points towards the direction of either anorexia nervosa or bulimia nervosa. So it is almost more than 90% accuracy in confirming the diagnosis of anorexia nervosa or bulimia nervosa. Okay. Bulimia nervosa is basically another eating disorder where the difference between bulimia nervosa and anorexia nervosa is that the patient with bulimia nervosa, they don't really present with weight loss. Their weight can be normal, they can be overweight as well, or they can be sometime underweight. But the main problem there is not weight loss. The main problem there is binge eating and vomiting. So anorexia nervosa patient, they avoid food. Okay, they have this extreme avoidance of food, especially high calorie food. Whereas bulimia nervosa patients, they have this characteristic pattern of binge eating. So they eat a lot of food, they make themselves uncomfortably full, and then they vomit. Okay, so they may be, they may use their fingers to purge themselves, or they employ different methods to vomit that food back. So they are constantly binge eating and vomiting, and because of the vomiting, they have uh, reflux esophagitis, they have a sore throat, they have poor dental hygiene. Okay, so bulimia nervosa patients, they have, they present with binge eating and vomiting. That is a characteristic of bulimia nervosa. So SCOFF questionnaire, if it has five questions. Each word of the SCOFF represents for a specific question. If the answer of more than two questions is yes, then it means that it is either bulimia nervosa or anorexia nervosa. Okay. So SCOFF questionnaire, the S stands for sick. Okay, sick. So do you make yourself sick because you feel uncomfortably full? C stands for control. So do you worry that you have lost control over how much you eat? Okay. And O means 1 stone. 1 stone means 6 kg. So have you lost more than 1 stone over the past 3 months? Okay. So O stands for 1 stone. Okay. Have you lost more than 1 stone over the past 3 months? F is for fat. So do you believe yourself to be fat when others says that you are too thin? Okay. And F is for food. So would you say that food dominates your life? These are the 5 questions which are in the SCOF mnemonic. So first we ask the questions to quantify the weight loss and to ask some questions pointing towards the direction of anorexia nervosa. Then we ask 5 questions of the SCOF questionnaire. Okay. And then we will do is to rule out a few differential diagnoses and to ask about the complication. Okay, because you have to rule out the differentials, a few differentials in case of in every case. Okay, because you cannot just assume that there is nothing else medically going on and it is just an eating disorder. So as the patient is presented with weight loss, we'll ask about hyperthyroidism. Okay, and cancer, the false mnemonic, and diabetes. So we will rule out hyperthyroidism, cancer, and diabetes. So we'll ask about, do you have any diarrhea or any change in the bowel habit? Do you feel hot when other people feel normal? Okay. Do you have any fever, any lumps and bumps anywhere in the body? So this is for cancer and diabetes. Do you feel thirsty or are you going to the loo more frequently? Okay, then complications of anorexia nervosa. So basically, one of the complications of anorexia nervosa is low mood, that is depression, and maybe self-harm, and the low blood pressure and amenorrhea. So we will ask about how is it affecting your mood. If the patient has low mood, then we will ask about self-harm as well. Okay. Do you feel dizzy? Because patient with anorexia nervosa, they can have a very low BP and they can feel dizzy. Also, they are very prone to electrolyte imbalances, which can also make them dizzy. And anorexia nervosa patients, they sometimes have amenorrhea. So we will ask about the last menstrual period. That is, when was your last menstrual period? These 3 questions are for complications of anorexia nervosa. Then we'll ask about meftosa. Okay, so do you have any medical conditions at all? Are you taking any medication? Any allergies? No need for family history here, but the psychosocial you will ask. Uh, would you describe your family and friends as supportive? Okay, what I do for a living and how is it affecting your life? Okay, and would you describe your friends and family as supportive? This is an important question because this is one of the point for admission criteria. Then you have the day mnemonic RKF deck. So it is D for diet, exercise, smoking, and alcohol. So diet, you will ask about, can you please describe your diet in a typical day, what you take for breakfast, lunch, and dinner, okay, and any snacks in between. Do you work out? Okay, so how much do you work out? Because this patient also do excessive exercise. No need to for asking smoking and alcohol. If you have time, then you can ask about smoking and alcohol, but because the history taking here is quite lengthy, so if you don't have time, then you can skip smoking and alcohol. So diet and exercise are very important, okay, because their diet is, very restricted diet. Like they can tell you that I eat an orange and a breakfast, and then I skip lunch, and then I eat a bowl of cereal or whatever in the dinner. So very much restricted diet, and sometimes they do workout, excessive workout. Ideas, concerns, and expectations. So this question here, it stands for not only ideas but also the insight. Okay, it also tells you whether the patient have insight and or not, because these patients don't really have an insight. So we will ask them, do you think that you need any help that we as medical professional can offer? So the patient says yes, I need help, and means that the patient have an insight. um, and is there anything that you are concerned about? So that was all about ideas, concerns, and expectation. Then examination, what we will do in examination, we'll check the vitals. Um, the BP is really important because these patients can be hypotensive. We will check BMI, and we will examine thyroid gland because these patients are presented with weight loss. So to rule out any enlargement of thyroid gland. And management will explain, first of all, will explain the condition to the patient. We'll tell the patient that it seems like you have a condition in which people perceive that they are overweight when in reality they are underweight. It is called as anorexia nervosa. I have checked your BMI. BMI is a measure of weight against height, and it tells us whether the patient has whether a person has a healthy weight. Normally, the BMI is between 18.5 to 24.5, whereas your BMI is this much. So if, for example, the patient has 17, BMI of 17, so we'll tell the patient that your BMI is 17, which is on the lower side. So it means that you have lost a lot of weight. What we are going to do for you, I'm going to inform my seniors, and I will order some blood tests, and that will include blood count, LFTs, RFTs, and electrolyte levels, thyroid profile, and vitamin levels. Electrolyte levels is very, very important because it is one of the admission criteria. The patient has electrolyte derangement. Now, if the patient has any of these red flags, then we'll admit the patient under the eating disorder unit. And this means a BMI of less than 17.5. If the patient is feeling dizzy or the blood pressure is low when you check the blood pressure. If the patient has intentions of self-harm. If there is tachycardia or bradycardia when you are checking the vitals. If the patient has electrolyte imbalance, or if the patient does not have enough support at home. So then you will admit the patient. If the patient does not have any of the described red flags, then what we are going to do, we are going to refer the patient to the multidisciplinary team. Multidisciplinary team will include an eating disorder clinic. So as an outpatient, not admission, but as outpatient, they will do something which is called a supervised weight gain. They'll also refer the patient to a dietitian, which will tell the patient how to what foods to eat, and psychologist to change the way the patient think about food and weight. Okay, and then we'll also do regular follow-up for these patients. So that was all about eating disorders. Eating disorders, there are a lot of other eating disorders as well, but the most important for the purposes of exam are the most important is basically anorexia nervosa, but you need to know how to distinguish anorexia nervosa from bulimia nervosa. And yeah, so there was all about eating disorders, and I will see you soon with the next video.